Hello everyone, it's Alex Sticchi on behalf of PCR Online. It is a great pleasure to contribute to the TCT 2025 coverage of the most important trials presented during the Congress in San Francisco this year. I have the privilege to introduce Professor Lei Song from Fuwei Hospital and the National Center for Cardiovascular Disease, Chinese Academy of Medical Sciences, and Peking Union Medical College, Beijing, who has presented the sirolimus-eluting iron bioresorbable scaffold in coronary artery disease, 2 years results of the IRONMAN II randomized controlled trial, which marks a major step in the evolution of bioresorbable scaffolds, moving from polymeric to iron-based technology. Professor Song, thanks so much for being with us and for presenting this important trial.
Yeah, thank you for the invitation. IRONMAN II study was a prospective, single-blind to the participant and multi-centers non-inferiority randomized trial, and 36 centers in China. I think the main objective of this study is to compare the safety and efficacy of the novel sirolimus-eluting IBS, the elements L-based metallic stent, and with the cobalt chrome sirolimus-eluting stent, which was a stance from Abbott, 1-to-1 ratio among patients with coronary artery disease. And I also said OCT sub-study to compare the embolization and intramural hyperplasia during 2 years follow-up. As we know, I think the permanent metallic frame was have some problems with chronic inflammation, neuroatherosclerosis, and a high risk of late-stage thrombosis. I think that's why the concept of the BRS was developed to overcome these limitations, I think. But however, the early generation of the BRS was not good enough with the suboptimal performance with high rate of late adverse event. So I think the key question of the current studies to test the safety and the efficacy of this new device and compare with the contemporary drug-eluting stent. And I think IBS with a novel thin structure design, and I think is the most important. With the thickness of the structure is 55 to 65 micron. I think at the same time it still maintain acceptable radial strength, I think.
Yes, and how can we summarize the key findings from the study?
Yeah, I think that after the 2 years follow-up, I think we found that the first IBS was non-inferior to cobalt chrome ES for the primary endpoint of the angiographic late lumen loss at 2 years. I think the second, we also demonstrated that the two powered second endpoints, the first target vessel QFR and the cross-sectional mean flow area by OCT is also non-inferiority compared with the ES. I think the third clinical outcomes with composite outcomes was comparable between the two arms, including the instance of the death, myocardial infarction, and the device thrombosis.
They are very important results. And so, what are the next steps for the IBS program? Are you planning a new study? How you move in the next future?
Oh yeah, of course. I think first the follow-up of the IRONMAN II study will continue up to 5 years to provide, I think, the more information whether the fewer adverse event went maintained after IBS fully complete resorption after 3 years. I think secondly, we also plan to perform a large-scale randomized trial involving about more than 1,500 participants. And I think the more complex population that will have enough power to examine the clinical outcomes, which is not powered in this study. I think that will definitely provide more information about this new device.
Fantastic. And long-term follow-up is very important. Professor Song, thank you very much for sharing these insights and for this important contribution to the fields. Thank you very much.
Thank you.